Hey everybody, welcome back to Jeff Bowles Central. I wanted to do another mental health discussion video for you this morning. Wanted to talk about mental pathology in terms of the things that are innate to what we call mental illness and the things that are not innate, things that belong to you specifically, your junk. Now, I want to have this conversation because I notice that when I talk about mental health, people fall into two camps: traditionalists, non-traditionalists. Traditionalists prefer the down the road psychology of it, the medical science even, and non-traditionalists very much value explanations for what we call mental illness from outside ourselves, even spiritual influences, if you want to call it spiritual. I think it's because it's not exactly completely understood by anybody, and I think that it's there's a lot of gray that we have to kind of grasp because it's a very complex thing, mental illness. But what I want to talk about here is the stuff that belongs to you specifically, the stuff that I don't care how spiritual you are, or how adapted you think you are. Everybody's got some junk in the closet, okay? And basically, this is why I advocate on this channel for things like therapy and things like medication, the traditional psychological routes towards tackling complex mental illness. Mental illness is not cute. Mental illness is not a joke. Mental illness fries you out. It fries out the people around you. It screws up your life. It's also not something that's particularly easy to handle. And there are a lot of factors to it that are completely outside of your control. Even if you want to talk about basic brain functioning, brain chemistry, brain structures, even if you want to talk about environmental factors, the way you grew up, okay, the experiences you've had, the traumas you've endured, those things are very much not.
I didn't understand that.
Those things are very much not within your control, but they're under your control to a certain extent, to the extent that anybody knows how to manage them, right? But you didn't force those things on yourself. But the reason therapy, okay, and medication, I know not everybody's into medication, and I know that that's slightly controversial. I take medication when I remember, and when I remember, I feel better, and that's all I know. And I know that that's not one size fits all, nor should it be. You really should talk with your doctor about all of this, because I'm not a mental health professional. I'm just someone who has suffered a very long time and who has been through a lot of counseling myself and who has done some research, not extensive. I'm not an expert, but this is a sufferer speaking to you. If you don't get your butt into therapy every once in a while and handle the gunk that you've built up from the things that you've done, for instance, what is mental pathology? Mental pathology is dysfunctional thinking or dysregulated thinking, behavior, and functionality in life, basically on a mental level, right? And everybody has some. Okay, but people with mental illness tend to have a lot more. And for instance, I've been mistreated by friends in life. I've been mistreated by peers. I was picked on a lot as a kid because I'm fat. I was bullied a lot. I've been bullied my whole life, but specifically as a kid. I have the pathological thought process that people are automatically not going to like me no matter who they are. Okay, that's built into me. Now, that's not something that I wanted to pack onto myself. That's not something I intended to pack onto my complete mental paradigm framework from which I approach all life situations, but it's there. Okay, and it's there in spite of my spirit, number one. Okay, it's there in spite of brain chemistry. Okay, it's there. And it's my responsibility, therefore, as a thing that's innate to me, Jeff Bowles, not anybody else, if I want to get better, then I've got to unravel something like that. You see that? That's your responsibility, Nia. That's not something God can do for you. That's not something, well, okay, that's I'm not going to open that can of worms. That's not something anybody else rationally can do for you on this planet, but you've got to learn to do for yourself. So why go to therapy? You go to therapy so that you can unravel this stuff, that you can unravel your own pathological thought processes. There's so many examples of bad pathology. There's anger issues. There's sex issues. There's any kind of addictive quality or addictive aspect to your personality. And it happens like this. Someone says something or does something to you at a young age or something. And like I said, you develop this idea, well, everybody's like that. Or I'm always like this because they said so or they showed that to me. So I'm always like this. And you develop a story about yourself. You develop this narrative of like, yeah, that's true, I am a cranky person, or yeah, that is true, I am miserable, or yeah, that is true, I am worthless. That my mom told me that one. You know what I'm saying? And how we grow as human beings and how we adapt to situations is we incorporate things like this because we have to have a rooted sense of reality just to get through the day. So, but because reality is imperfect and people are definitely imperfect, we have these things that maybe even at one time they were adaptive. Maybe they were perfectly suitable to that situation, but they're not anymore. Okay. None of that stuff is covered under spirituality. None of that stuff is covered under brain chemistry. You can't pill that stuff away. You can't get a prescription to get that stuff gone. It doesn't go away unless you get in there on the ground floor in the wrestling ring. You get in there and this is why therapy, because you have a professional who's trained to do this, walks you through your own pathology, gets you to see. Do you see that? Do you see how that might not be functional? What do you think of that? Turn it on you. There's always this stereotype of therapists or psychologists spending all your money, your hour-long $100, $200 session asking you, what do you think about it? Well, there's a reason. This is you, okay? If you took your car in to a mechanic and it could talk, you'd ask it, what's wrong? What do you think about it? How are you feeling? Okay. And same with a doctor. So it's not unusual for that. And it's not unusual for people to kind of be down on this whole process because there's a lot of stigma around it. Nobody wants to be crazy. I didn't want to be crazy. I've got schizoaffective disorder. The unique thing about pathology is it's also quite separate from things like hallucinations and delusions, even though they function very similarly. Delusions also drive you to misperceive the world. But again, that is a function of the disease. Whatever we want to call the cause of the disease. Pathology, your own mental pathology, has forced you to see the world a certain way, but you can do something about it with actual work. Unraveling. Journal it. Try starting a journal. I used to do this when I was younger. When I was in my early 20s and late teens, I suffered a really bad bout of depression. I was very suicidal. And I knew that I had a whole life to live ahead of me because I was only like 20 years old, right? And I knew that if I wanted a chance at that life, I had to figure something out. So I went to therapy. I got it unraveled, more or less. Not for a lifetime, trust me. But at that time, I was feeling very, very, very much better. And one of the things that helped was I had a journal, and I used it every night. And through the journaling, even if you never read it again, which I never have, I don't even know where they are, those journals. But the process of taking those things which are hidden and bringing them into the light It's the only disinfectant for this stuff. As long as those things inside of you that cause you to behave a certain way remain hidden and unaffiliated, there's no knowing about it. There's no understanding it. There's no perceiving it. You see your behavior, but you don't know where it comes from. You understand? And yeah, I suppose you can try to work through this, or you can get direction from some kind of advisor who's not psychological, who's not a trained therapist or whatever. You can go to Brazil, South America somewhere, and take ayahuasca and try to plumb the depths of yourself. Okay, there's a lot of things you can do, but consider the possibility that, like, just go to a therapist. They're pretty much free and available to just about everybody in my country, the United States. Maybe, depending on where you live and depending on who's in charge. But the thing is that what I want you to consider is I have the ability, because this is my pathology, this is my stuff, this is the stuff I've accrued in this life through my own experience. I am the only one capable of getting down in that trunk, that closet, and cleaning it out as best as I can. And trust me, you'll never get rid of all your faults. I don't care how much therapy you go to. Life is built with faults. Life is built with flaws. You are built with flaws. And frankly, because I do have a worldview that is on the more spiritual side, just because I've developed that in my life. Not everybody has, and not everybody has to. I don't care. I tend to see things personally as purposeful rather than random. That's the way I see the world nowadays. In that sense, I wouldn't trade my flaws for nothing, because they make me who I am and they make me who I need to be furthermore in this life. However, to the extent that I can get better, just so that I can live a better life and treat people better, those two things exactly, two things. Live better, treat people better. Live better, treat people better. If I can do that by plumbing through my own pathological processes, trying to iron out the kinks to whatever extent that I can, if I work on that, I can probably treat people better and I can probably live better. That's the way I think. I also see it as a low-hanging fruit situation. Some of these other highfalutin ideas, yeah, go for it if you want, if you think you have the headspace for it. Try the low-hanging fruit first. Why go for the apple at the top of the tree when there's one down here? Low-hanging fruit. Work on yourself as much as you work on anything else. That's all I think. For those two purposes, I want a better life. I want to treat people better. That's it. That's the way I see it as of today. So in the comments, if you agree, if you don't agree, if you think I'm an idiot, if you think I'm an idiot savant, go ahead and tell me. I want to run a couple channel things by you as well. I've started a music live stream that streams all my music kind of like all day long. I don't know if anybody wants that and if anybody needs it or if it annoys anybody. You can let me know about that. You can also let me know if your dog is pregnant or if it needs some food. Just let me know anything. Let me know you're alive. Okay, we'll stop there. Be well, everybody. Do what you can. It's a rough time in the world, generally speaking, kind of no matter where you are, there's problems abound, it seems. But again, that's kind of life to a certain extent as well. So be well, treat each other well, treat yourself well, and I'll catch you next time on Jeff Bull Central. Like and subscribe, everybody. Bye-bye.
Pretend to be the man who cares about a single thing, apart from touching me and gladly taking all the blame. I'd sell my soul just to tear you from my brain. She said you're dead to me, just dead to me.